Okay, good afternoon, everybody. And thank you for that nice applause during the photo. That was unexpected and quite delightful. So my name is David Jaffray. I'm the Chief Technology and Digital Officer at MD Anderson Cancer Center, and today has been a very illuminating day for me. I am very excited about the impact of AI on cancer care, and we're constantly thinking about the challenges and the opportunities moving forward. And so today I'm going to talk a little bit about some future perspectives and some closing remarks. So I'm between you and a reception and a showcase of posters and innovations. I thought I would start this conversation with some feedback we've had over the course of the day. Questions around where we are in the hype cycle. But before I do that, I want to get a big round of applause from everybody for all the fantastic presentations, panels, questions. Come on, I want to hear a round of applause. Come on. Okay, that's good. Let me test that one more time. I am the last thing between you and reception. Okay, now we're talking. Very good. You guys have skills, very good skills. Those applause skills are going to come in handy as I probe the feedback from the audience today. Does everybody know what this is? Of course you do. It's the Gartner Hype Cycle. Do you know that it was actually defined and created by an analyst named Jackie Fenn back in 1995? She was struggling how to place how technologies are and they move forward, and she just worked this up on a napkin, and henceforth it's in every Gartner report and it's part of our vernacular. So technologies start in the lower left. There's a trigger, something happens. You could call it ChatGPT. You could call it the wheel. That was a big technology advancement. There were chief wheel officers back in the day. You know that, Dr. Zirwas. Maybe it was a steam engine. Everybody gets very excited. There's a lot of hype. And then the hype doesn't really fulfill, and then there's this trough of disillusionment, and then the slope of enlightenment emerges where impact is finally realized. And I'm sure you were all going up and down these surfaces over the course of the day. Are we at the plateau of productivity? Are we struggling up the slope of enlightenment? Or are we stuck in the trough of disillusionment? So I'm now going to use your applause skills to help get some feedback from the audience. So who believes we are here at the plateau of incredible productivity? I want to hear some applause. Crickets. Oh my gosh. Okay, we got a little ways to go. Okay, next choice, going right to left. Who thinks we're at the slope of enlightenment? There was some good work done on this stage today. Congratulations if we're moving to the slope of enlightenment. Who's at the trough of disillusionment? There's some very dark, sinister corner in the back. Who thinks we're at the peak of the hype cycle? Is that it? Any other suggested locations? A little bit to the right, I hear. Yes, Sammy. You're just coming off the peak. You're telling me we're heading to disillusionment. Amy Parmer, he heads up ethics here at MD Anderson, and we're heading to disillusionment. Very cheery. I really do believe that we're on a very exciting point in time. Exciting for many reasons. This is a technology that will transform the world. We all see it coming. We're a little bit confused by it, but we see clear opportunity. Simultaneously, we're faced with many, many possible choices. We can see even amongst ourselves where we sit. Are we ready to go? Do we want to hold back? Are we going to be advocates? Are we leaning in? Or are we just going to keep producing new technologies? So I just assembled 4 messages for today. And I think some of these resonate very well with the conversations. Message 1. Healthcare in the not too distant future, and in fact in some organizations already, will run thousands of AI-based agents. We had to do an audit as part of a state of Texas institution and send back how many AI algorithms we have running already within the organization. I know groups that interact with other large-scale healthcare organizations where they have hundreds to thousands of AI algorithms operating within their organizations together. And this is a big shift. Can you imagine an organization with hundreds or thousands of these algorithms and agents operating? How capable are we going to be to understand exactly what is going on in that organization? I'm sure you've heard of Rube Goldberg. He has many such contraptions, and in many ways, healthcare right now is designed as a bit of a Rube Goldberg machine. We don't have a state description of its current state. We do have this one great feature, though, is that we get to rely on a human. And the fact that humans make mistakes, that's okay. We teach them and we train them and we continue and we move on. As we move forward with technologies, with computation, with devices, that tolerance to the fallibility of the human will not be there in the same way. So this technology is going to require us to have a higher level of monitoring than we currently have today. That's a big lift. How will we defend their use and their performance? How will we explain when they fail? What data do we need to support our decisions? How will we balance the risk against the benefits? How will these be coordinated in operations and in not just the design of the health system, but in the continuous redesign of the health system? One example is we have this ambient technologies now rolled out within our organization at a certain scale. It changes the nature of the clinical reports. Those reports happen to flow into an NLP pipeline. The NLP pipeline's intake is changed now because of those ambient generated reports. This is a cascade of different technologies that are now starting to happen within the organization. That's going to be a challenge to manage, but we'll figure it out. We heard great conversations today about how we're going to understand and manage these moving forward. This is not to mention, can we actually measure the return on investment? And increasingly, healthcare is dependent on digital technologies. So in the past, you could always go back to paper. Once we go to AI, it's going to be difficult. Even more difficult to go back to paper. So as we look forward to adoption, we have to think about the security that needs to be scaled up. This capacity to manage this kind of technology is not an IT capability today. It's not a CMIO capability. It's not a medical advisory board capability. It is a new skill that we have to develop. How do we build it? What will compel us to invest? I think someone said something about a steam engine today. I think that was Jaji talked about the steam engine. Jaji, are you here somewhere? Lurking still? The steam engine was an incredible advancement in terms of the Industrial Revolution. Everybody knows about James Watt, the guy who invented the steam engine, at least the most proficient version of the steam engine. And everybody's seen a steam engine. Who hasn't seen a steam engine? You've never been to like a museum, a science museum? There's this really weird thing on every single steam engine, and I'm going to point it out right here. It's that weird-looking thing. You see it there by that red dot? That's called a flyball governor. And the flyball governor was the key technology to allow the steam engine to run at a stable, consistent speed. The steam engine would turn, but it would turn differently in the sunshine, on a cold day, on a hot day, and if you're going to weave product of high quality, you needed to have consistent power. The flyball governor gave the feedback to that powerful steam engine to keep it running smoothly. A great example of how we have to innovate and how we govern the power of AI so that we can also move forward efficiently and productively and safely. Being in Texas, some people say data is the new oil. Data is not quite like oil. People think about how it's powerful and lets you do things, but what I've learned is that unlike oil, data use needs context. You can ship oil anywhere, and it works just fine there. When it comes to data, you need to know where it came from and where you're going to apply it. Similar paradigms, but a big lift in terms of the need to understand where did that data come from? what's the context it was acquired under? And with that context, how does it affect where we can also then apply it again? Back in 2021, we wrote this little article about how cancer needs a robust metadata supply chain, a supply chain of feeding data forward such that AI will be robust from location to location. This is driving actually a lot of the work we're doing within MD Anderson. We say observations must be held in context. We want that metadata around that observation. We don't want to strip it all away. If you strip it all away, you don't really know where it came from. And that's why during the pandemic, we had these mashups of imaging data from a whole variety of different contexts. And those algorithms for detection of COVID in lung didn't work very well. If you capture that context, you can measure the quality. You can assess the quality. You can also trace from where it came. It wasn't fake or generated. And finally, you can actually govern that data well. And this skill set is critical moving forward. Algorithms depend on the data for training. Algorithms depend on the data for inference. So building the capacity to assess the quality of data coming in so that we have confidence in the output of the algorithms is key. There's a great little website called Evidently AI where they talk about this just beautifully, about how algorithms shift through time. They're unstable. There are many external factors. You do a patching. You may patch a system, and it could change the performance. The data can drift through time. So this capacity to manage and monitor that flow of data through time is critical. Are we willing to do the foundational work to realize the potential benefit of AI? And I think that's the question that's going to come up more and more and more as we see the promise, but without the data being a high quality, it's going to fall short. The exciting thing is that there's actually more benefit than just making the AI work better if you do this. If you get higher quality data, you'll get better insights. We get things like outcomes and other important information coming forward. Now, AI can help us there too. The ambient listening technology is extremely powerful. Rather than have a human capture that and write a note, going more directly to the conversation, extracting the information, not just what was said, but maybe even the sentiment of that conversation is really going to improve the quality of the data flowing into that data supply chain. Message number 3. We've talked a lot about care today. And Peter this morning mentioned this crazy, exciting space of AI for hypothesis generation. Message number 3, Copilot is cool, but pretty soon it'll be your co-investigator. And it's very clear these technologies are going to allow us, or even without us, have hypotheses generated, not just generate the hypothesis. This article from back in 2022, which took a while to get published in 2023 now, by Boyko, demonstrated a remarkable feat, fully autonomous chemical research with large language models to identify a research question, identify development. That was pretty cool. But then to go further and to use LLM technologies to code the interfaces via the APIs to the robotic devices in the laboratory. All done with a large language model, and what was then pretty crude agentic technology, given that it was 18 months or so ago. It's pretty crude nowadays. But this is just the hint of what's coming. And tomorrow we'll have some more conversation around the future of innovation in academic medical centers. And so what are the implications of this for academic science? You heard Peter Pisters this morning mention that we're building a new research building. It's called Scrub 5, just several hundred meters from here. And the idea of dedicating a few floors of that to AI-powered hypothesis and robotically tested hypotheses with a full feedback loop is a real consideration. And we'll do it either in academic medicine or industry. We'll do this with or without us. But what is the role of human insight there? How will we validate? This is all so exciting. It's a little bit dizzying. So I've come to the realization, and I get a great fortune of working with a guy named Dan Schoenthal. He's our Chief Innovation Officer. He may even be floating up in there. He is up on the second floor. He's always higher than I am. It's a very good position. And what I've learned, and in conversations with him, is that in all this excitement, the skill you want most, facing opportunity, is the skill of innovation. Innovation is not making something or a device or an invention. Innovation is seeing the problem very clearly. And as someone said up here earlier, asking the difficult, critical questions and understanding if those questions are resolved and those problems are solved, what the real value will be. What is the problem we are solving? Innovation, skill, and discipline is required to really develop the case for need. We heard that today. Do we understand what decision we are supporting? How well do we dissect that decision? Because that's key to figure out whether a prediction will be helpful. How we measure the value. We need a data-driven approach. Cost, benefit, downstream impacts, unintended consequences. We looked at using ambient technologies back when it was nuanced DAX about 3-4 years ago. We experimented with it. It didn't work. It didn't work. Doesn't mean it wasn't going to work. It just wasn't the right time. Technology wasn't mature enough. So then we tackled it again, and Dan's team led this, where we did a bake-off between nuance and a bridge. And we compared, and we measured pajama time, how much time the physicians. We measured how long before the reports would get in. The differences were subtle between the two technologies, but we ended up settling on a bridge, and we're now in the process of rolling that out. We learned a lot through that. We learned that I don't think it's going to save us anything. I think it's going to cost us, at least from a strict financial perspective. But we learned that the clinicians were better enjoying and appreciating their time with the patient and vice versa. And so that's a choice about how that ROI gets delivered. I like to think about the fact if you're like starting to weigh down this pathway of AI solutions and adoption, I think you kind of start to get there when you realize you can turn an AI technology. How many people in the room have turned an AI? I'm not talking about your phones. Lots of people turn off the AI on their phones. How many people in healthcare has turned off some AI technology so far? Okay, I see a few hands up. To me, that's a sign of starting to apply this. When you realize it's not working and you got to turn it off. Because the temptation is just to add on and add on and add on. So that's part of that innovation skill. Getting the data, validating, and making sure that we're getting benefit moving forward. So, no other technology has ever stressed our innovation skills like artificial intelligence. If you can get people who are good at innovation, these are often like successful startup people, people who challenge, people who see a different perspective, capture them. And if you have them, hang on to them. They are the secret sauce in turning the opportunity into reality. The wheel, that was a pretty exciting time when that first came out. Innovation was really important. How are you going to use the wheel? A steam engine, similarly. But AI is going to stress the need for that skill like never before. So with that, I'm just going to bring some closing remarks to what I think was a pretty amazing day. It was sold out. It was like 550 plus 170 or something online. Amazing. Can I get a round of applause for the organizing committee, the ones that are up here? It was clearly called out that this was a unique moment in time, coming together in terms of an opportunity across an amazing system and technology, and we're kind of starting to slide down that slope, right, Amy? Starting to go down that slope in the path of illusionment. The idea that we can do more than just pour out technologies, we can actually turn it into a process of learning. This is a really powerful thing to contemplate. And I believe that AI isn't just going to be just point systems. It will lead to a full transformation where we're able to not just use it to be more efficient, but use it to learn more efficiently. We also learned that this has a lot to do with collaboration and the acceptance that technology is not going to be just procured and rolled out. It's about steering it thoughtfully, and there's collective and collaborative learning to do that. And also that we really have to work closely with the clinical teams to learn the value. And finally, that there's a broad opportunity in Texas and beyond. And the potential for further collaboration, for further challenging, to really think about how do we innovate all the way to the bedside and back again. So I'm going to end with that. Thank you for a fantastic day one. I think we have a super exciting, bright future ahead of us. We've all been thrown like babies into water, swimming in this new opportunity moving forward. And I just love this picture because it's so exciting. And tomorrow, we're going to talk more about innovation. Just a couple final notes. With me stopping, the reception opens up. There's also a showcase of posters and innovation showcase on the 4th floor. There's food stations here and on the 4th floor. And with that, see you tomorrow at 8:25.